This is Cameron with Texas Homeless Network. Welcome to our CoC General Meeting, March 8th. I'm going to go ahead and have those folks in the room go around and introduce themselves quickly.
Hi, I'm Mary Ricklet, CoC Manager.
It's Craig Blaze Fierro, CoC Programs Assistant.
Caitlin Baer, Balance of State Programs Coordinator.
Kristen Walichka, Vista Resource Development Associate.
Jason Phillips, Vista Program Manager.
Well done, Paul. Craig, can we go ahead and pull up the map?
We are on the way.
So just like to show you all the representation we've got across our geography at the meeting today. We continue to see new dots on this map and hope that that's a trend that we continue to see. And we'll just ask again if there's anyone in your community. Sorry, y'all, we have a sick dog in our conference room today. And I just may have hit his foot with my chair. It's my sick dog. And but yeah, if you all know of anyone in your community that's not aware of these meetings or other communities that you work with, we really encourage you to share all of our materials and meeting announcements and trainings with those folks, and appreciate you all doing that. I'm going to go ahead and move into our spotlight. Mary is going to share some information with you all about Homelessness Awareness Day.
That's what I'll say, right?
Yes. All right. Well, we held our Homelessness Awareness Day at the Capitol last week on Tuesday, February 28th, and we were able to visit about 50 offices of senators and representatives in the state legislature. So we know we had at least 50 people there, possibly 60. Some people joined us throughout the day, so we weren't all ever in one room at the same time, and we weren't even all in the picture at the same time. So we're not quite sure how many people attended, but thank you to all of you who were able to come and join us in person in Austin. And thanks to those of you who were able to make phone calls on that day to your legislators as well. We wanted to just give you a little wrap up. And we also put all the materials that we used on that day on our website, so you can continue to use them, particularly if your representative was not reached on that day. You can give them this material or you can send it to them. We just want to quickly go through them. If you go to our website at www.thn.org, you'll get to the homepage and click on this tab I'm pointing to called Advocacy. When you click on the tab, you'll see this advocacy page. And there's a whole section here on Homelessness Awareness Day 2017. Obviously, no registration or sign-ups right now, but here are the materials. There's a PowerPoint presentation. That was the training. You can watch that if you'd like to. But these are all the materials that were in the packets that we gave. So I'll just go through the talking points briefly because they highlight what we were discussing with our legislators. That there are 23,000 persons experiencing homelessness in Texas on any given day based on the 2016 point-in-time count. So that number alone, when I told legislative aides about that, they were really surprised at that large number. Good news, since 2012, homelessness in Texas has decreased by 32%, and that's based on point-in-time counts from 2011 to 2016. This decrease is in large part due to the state's Homeless Housing and Services Program, or HHSP. That's the only pool of state funding that comes from the state to local communities, the 8 largest communities in the state, to address homelessness. And then there's also the Balance of State Technical Assistance Fund, which is money that the Texas Department of Housing and Community Affairs, or TDHCA, makes available to Texas Homeless Network to facilitate work around the Balance of State continuum of care, which is 215 counties large. And so we were advocating not to cut those funds. They are at risk of being cut with budget cuts across all state departments this year. We also wanted to make sure not to cut any money from TDHCA's budget that goes to the Housing Trust Fund, which helps to create affordable housing around the state. And finally, the fourth ask was to make a change to the Healthy Community Collaboratives program that would allow match funding to come from public sources, not only private sources, because that pool of money is not being spent down fully because we've heard from many people that the match requirement for private-only sources is not enough for them to be able to provide the match, which means they can't pull down all that funding. So those were our four asks. And then we had some really neat infographics. Thank you, Kristen, for creating all of these. Uh-oh. Oh, it's taking its time. Well, Okay, here it goes. So these are a really helpful way, I think, to, in pictures, talk about what it is we're looking at. So here you can see that dramatic decrease by 32% in homelessness over 5 years. Then on the back side, a little bit of information about, okay, some population characteristics of the population in the 2016 point in time count. For example, 23,000 people counted, that's where we got that figure. About 50% of the adults had some barrier to housing. More than 1,000 unaccompanied youth were counted. Unfortunately, 2,000, almost 2,300 households with children were counted, and that we've only decreased about 1.5% from 2015 to 2016. However, much bigger increase in people who are experiencing chronic homelessness of 18%, and an even better increase or decrease in homelessness among veterans of 26%. So again, this information can be presented not only to your legislators, but anyone in your community who wants more information about homelessness in Texas. And then we have different handouts on HHSP, on the Balance of State Continuum of Care Technical Assistance Program, and on the Healthy Community Collaborative. I'll let you guys go through that on your own. And finally, the last item we have is the phone script, which we did make available before that day, but it is never a bad time to make a call to any elected official and let them know what we're doing and why it's important, and asking for certainly no funding cuts. So we wanted to make sure you knew those materials were online, and again, thank everyone who was able to come on that day, and encourage you to continue your advocacy efforts, and feel free to use these materials.
Okay. Thanks, Mary. Just also, since the topic is funding related, just I'm sure some of you have seen the first draft of the budget come out from the White House, and we still have a long way to go, but there are cuts being proposed to HUD funding anywhere from 10 to 15% across the board. So just something to keep in mind. You know, the work we did this past week was definitely focused on the state, but we all need to keep in mind our federal funding as well. We are going to move on now to Caitlin, who is going to speak to you all about our CoC written standards.
Great, thanks, Cameron. Hi, everybody. This is Caitlin Baer. I'm the Balance of State CoC Programs Coordinator, and I wanted to share with you guys today something that I have been working on, certainly for the past couple of months, but actually since I got hired here, so what is that, 1.5 years now? So I wanted to share with you guys what written standards are, where the requirements come from, and also wanted to announce today that on Friday we will be opening these standards up for a period of public comment, so we can make sure that we include feedback from folks across the balance of states. That way these requirements that I'm going to go over with you today are fair, that they're reasonable, and that they're well informed by local needs and priorities. So let's dive into it. Here is the table of contents for the written standards. It's not going to make a lot of sense until I explain to you what the written standards are, but I wanted to point out the sections, so as we go through them you'll be kind of aware of where we're going. There's an introduction section. I'm going to explain what the written standards are and who they apply to there. There's some essential elements that are going to apply to all projects across the Texas Balance of State Continuum of Care. And then there's a big middle section called Program Guidance. This provides guidance for programs of different types across the Texas Balance of State Continuum of Care. Each one will only apply, each set of standards will only apply to a project of that type. So for instance, emergency shelter program guidance obviously only applies to emergency shelter, where transitional housing will only apply to transitional housing, and so on and so forth. We also have some larger standards about termination policies for your participants in your program, the confidentiality, I have a hard time with this word, confidentiality and security of participant records, and coordinated entry use. And then I also want to tell you guys about some exciting appendices, which makes me sound like a mega nerd, but some really exciting appendices for these standards. So the written standards come from the Continuum of Care CoC interim rule, which is the rule that codifies our CoC planning process that provides a pool of funding for homeless intervention services and establishes this geographic area called the Balance of State CoC, among other geographic areas. So it's this rule that says we have to plan for this particular geographic area and specifically pertaining to this funding source called the CoC program. So in that rule, it specifies that the CoC lead agency needs to establish certain standards for providing services. And those standards that are codified in law are the following. I will try to make this as non-boring as possible. But we need to provide you guys with standards for how you evaluate individual and families' eligibility for assistance. So how do you decide who's eligible to receive CoC program assistance? We need to provide you all with policies and procedures for determining and prioritizing which eligible individuals and families will receive transitional housing, rapid rehousing, and permanent supportive housing. So of those folks that are eligible, who is prioritized for services. We also have to provide you all with standards for determining what percentage or amount of rent each participant must pay while receiving rapid rehousing assistance. We also need to provide you guys with policies and procedures for determining and prioritizing which eligible individuals and families will receive permanent supportive housing assistance. We've actually already adopted a couple of policies and procedures through the CoC board, which you can find on our website that pertain to a couple of different HUD CPD notices that are out. But we wanted to make sure that we reiterated them here. But there's a couple of additional reasons that I think having written standards for our continuum of care is a really, really good and helpful thing. And that's that we want to try and orient our services to be fair for everyone, to be well understood by homeless participants, and to demonstrate that we can end homelessness by adhering to certain performance standards. So having these written standards will really unite our vision and our strategy for ending homelessness across our geographic area. We are using data and resources and evidence to inform the practices that we are going to require our projects to use so that they can be effective as possible. We want to provide uniformity across the Texas Balance of State CoC geographic area, so that way if a homeless participant gets services in Texarkana or Lubbock or Abilene or Laredo, that they're going to receive the same standard of services, and that we can demonstrate program accountability to individuals and families experiencing homelessness. So that way any person who's experiencing homelessness can rifle through these standards and know what they can receive, what the rules are, and what their rights are in receiving program assistance. And then last, I always hate to bring this out, but we do need to ensure program compliance with HUD regulations, even though we know that a lot of you guys already have policies and procedures that make sure that you're in line with HUD regulations. Never hurts to have some more. Important note about the standards is that they aren't going to replace the rules, the federal rules for the programs that you receive. So if you're an ESG recipient, you still have to follow all the ESG rules. If you're a CoC program recipient, you still have to follow all of the requirements in the CoC interim rule. If you receive RI, if you receive SSVF, these written standards don't overwrite what your program requirements are. Instead, they're supposed to be supplemental and to help guide you in program design and in your policies and procedures. So at minimum, all CoC-funded programs must comply with these written standards. However, our ESG programs, they need to be aligned with these and their written standards. We encourage our SSVF providers to take a look at their written standards and make sure that they are in line with these. And all other programs, even if they aren't HUD funded, we would just really encourage to at least take a look at these and see if there's something that your program can comply with. We hope that they will be. And we're hoping that by putting these out for public comment, that you all will be able to provide the kind of feedback that we would need to hear to make sure it can be applicable. Oh, thanks, John Cooper. So I know that we kind of call out John Cooper a lot. We were actually talking about this before. That's because he participates. So we want to make sure that if you out want to get a shout out from us, that you can also comment and we will shout you out. But his question is this available on the THN website? Not yet, John Cooper, but it will be on Friday. And I will go over this. I just wanted to go over quickly what the written standards were about, and I'm going to plug through the rest of this fairly quickly. So we are asking for your comments on these written standards. We want to make sure that these are things you feel like you can comply with and that are in alignment with what it's going to take to end homelessness in your communities. So we're asking for comments on these specific sections that I'm about to highlight to you. 1, essential elements. These are things that, regardless of program type, we want you to adhere to. These are things like utilizing a housing first approach, like complying with the CoC policies and procedures, like participating in coordinated entry systems, like attending Texas Balance of State CoC general meetings, which are these meetings. Take a look at these and provide us with comments if any of them seem confusing or unfair, or if you're like, hey, yay, that's awesome, then I always enjoy that kind of feedback because it makes me smile. The next section, program guidance. I would specifically ask providers of these particular program types to provide feedback on their program type because clearly you're an expert in that program type and you would know what seems to be the most reasonable, fair, or what would be a good goal to set. So I'll show you the areas that are highlighted. You'll see some essential elements that just define what a program is and what kind of services that it should provide. You'll see participant eligibility. You'll see prioritization standards. For some program types, we're required to do prioritization standards. For others, we are not. If it's an NA, that means we are not required to set prioritization standards for you, though of course you're welcome to do it yourself. But here is an area that is highlighted. This means this is an area that specifically we would like to get comments on. You're welcome to comment on anything, but for these areas marked in yellow, please, please, please let us know what you think. So for instance, performance metrics in this section, it's street outreach. What do you think is a benchmark or a data point of a successful street outreach program? We want to hear what you think. So let us know. That is part of your, it can be part of your comment. Now I will say that right now it doesn't have anything under it. The reason why we are not releasing the standards today is because I would like to put on there some food for thought for you guys. So I will be putting up some proposed performance metrics. So that way you guys can kind of get an idea about where we're going with it and provide comments. So that way you're not just, out of the blue, what do I think sounds good? We'll be providing you with some sample benchmarks and things like that you're welcome to provide comments on. So don't feel like super pressured to go out and do a bunch of research because I've already done it and I just need to put it in this document. So same for HP, which is homelessness prevention. We have a section here on diversion. We'll have a section for all types of different temporary housing, including emergency shelters. So I'm looking at you, ESG-funded recipients, to provide us with feedback on this. Also, our privately and faith-based shelters, please, please, please provide us with some input on your performance metrics. Inclement weather shelter. This includes shelter that's not open all the time, just whenever the weather is bad outside. We've got our transitional housing folks in here. We've got our bridge housing folks in here. Everything highlighted in yellow. Please, please provide us with some feedback, because we want to make sure that these are standards that you guys can actually comply with. We want to be fair, we want to be thoughtful, we want to be cognizant of the needs of your community. For permanent supportive housing, we already have prioritization standards, but rapid rehousing, we're having a tough time thinking about who gets prioritized for rapid rehousing assistance. So this is an area that our rapid rehousing providers, or our soon-to-be rapid rehousing providers through the CoC program, would encourage you guys to really think about what prioritization standards would make sense for your community, and to provide comments to us specifically on this for our rapid rehousing providers or our partners in the community that work with rapid rehousing providers. Would really encourage you guys to provide that feedback there. So those are the specific program areas in which we're looking for feedback, but there are more areas than just program guidance. We have a termination policy. We've left it pretty loose here, just saying that your programs, policies, and procedures have to have a termination policy that is written down that at least has 4 following elements. This is because we have so many different program types in these written standards. We want to make sure that there's enough flexibility in here for an emergency shelter termination policy to look a little different from a permanent supportive housing termination policy, to look a little different from a transitional housing one. So let us know what you think about termination policies and procedures, as well as confidentiality and security of participant records, to make sure our client's data is staying safe and secure and is only being shared with who it's supposed to be shared with. Not that we think y'all are doing that, just that we need to write it down. There is coordinated entry, written standards that are going to be coming out soon from our systems change coordinator, Sophia Cheka. So you'll find the coordinated entry written standard here to be a little bare bones. It basically says you have to follow her written standards when those come out. This is an absolute must for our CoC and ESG program funded projects. You absolutely have to have a coordinated entry system and to comply with the CoC's process for it, as well as the written standards. So this is a little bare bones. It's that way on purpose. But if you have something you'd like to add to it, obviously please provide us with a comment. The coordinated entry written standards are not going to be ready by Friday, so you won't have the opportunity to provide them with feedback then.
Yes.
Will they? Will they? Oh, I misspoke. Spicy. Okay, so they will be ready on Friday. Or maybe we already, I don't know, we're having a side conversation. Sorry, y'all, I don't want to mislead you. And then the very last thing is appendices. There's going to be a lot of really cool appendices in these written standards that are going to, don't laugh at me, that are going to really help you be able to find these written standards to be accessible and memorable and something that you can comply with on a day-to-day basis. So for instance, one of the cool things I'm going to put in here is a desk guide that puts all of your program's written standards that apply to your program in a nice little chart that you can print out, you can keep on your desk, you can keep on your bulletin board, so that way you have a good idea just in sketch format, right? Like who's prioritized for your program, who's eligible for your program, what kind of financial assistance can you provide, so that way you can just kind of have that as a reference guide. We're going to have a definitions section in here, so if some of the jargon in this document are a little bit confusing, rest assured there will be a section where we unpack all of the acronyms and all of the definitions. We'll be including maps and links to cool things. I get really excited about this stuff, y'all. So stay tuned for that. And I wanted to also quickly, and I know I'm kind of overrunning our time here, want to show you guys how you can submit comments. So there is a Google form that we will be using, and I will make sure the link goes out very soon, probably via constant contact email. That will lead you to this form. Because the standards aren't currently linked to on our website, you will be able to find that link here when it is available. I will be posting them on Friday, as well as providing this form link on Friday to everyone, so that way you can start with providing us with your comments and starting your review process. The written standards public comment process will be open until Friday, March 24th. So you have a good chunk of time to set aside some time to review these and think about them and do some research or check your data out to provide us with comments. I provided some tips for generating good comments here if it's not something you've ever done before and want a little guidance on. You're also free to reach out to me at any time during this process if you're not sure or need clarification in order to provide a comment. My email address is right there. I will be on deck for 2 weeks, just waiting for any questions that come in. I wanted to show you guys how to fill the form out. This form isn't just for agencies and organizations providing services. You can also provide it to maybe someone on your board or someone who is currently or formerly experiencing homelessness, who has a good idea about what these should look like. Anyone in your area who has a vested interest in ending homelessness, who you think would have something helpful to say about how standards are provided in the Texas Balance of State CoC, please share this with them. LHC presidents on the line, our local homeless coalition presidents, please pass this along to your members and ask them if they will review the standards and provide us with a little bit of feedback. So here's just sort of your normal form information. If you have a job title with your organization, put it there. Let us know where you're from, your geographic area, so that's just the city that you're located in. If you are running an organization that receives federal funding, go ahead and click it. If you are, let's say, a faith-based organization that doesn't receive federal funding, that's cool too. Just click this, my organization is not federally funded. If you're a person who's currently or formerly experiencing homelessness, it's cool, just put NA. If you don't have an organization, that's cool, we still want your feedback. So in the next section, after you sort of fill out, oh, it won't let me even show them the next section. Here, Craig, help me out here. All right, I'm gonna click some things. Give me some of those. All right, I'm gonna regret this as far as my data progression goes. Oh, thank you. All right, well, let us go. All right, so here's the next section. I've tried to divide our standards form into some different sections so that way I, as an editor, can better locate where your comments are. Because we've noticed in some other public comment forums that someone says, this needs to be changed, but we don't know where it's at, so we can't fix it or revise it. So if you have general comments, put them in this first block. If you have comments about the introduction section, put it here. Comments about the essential elements section, put it here. If you're providing guidance on program guidance, then awesome. Just make sure you let us know for which program you are providing your comment for. So just put like street outreach and then continue with your comment, or HP and then continue with your comment. Termination section, y'all know, confidentiality and security of records section, and then the coordinated entry section. And then you hit submit and it will show up in my inbox and I will review it. I will synthesize it within my very soul and I will change the the written standards to be as equitable and as transparent as we possibly can. You are also welcome to email me comments if you are, for whatever reason, not comfortable using Google Forms. Then you can just write up a comment and send it to me. The form will be, not the form, I'm sorry, the written standards will be available for download, so if you just want to highlight things and email it to me, that is also a welcome way to get comments. So I wanted to run those over with you guys. Do you have any questions, anybody in the studio audience, before we move on? And just to remind everyone, this is all going to go out in an email on Friday, so it will not be found on our website just yet, because I want to make sure I get some suggestion performance metrics in there for y'all. All right, thank you.
Thanks, Caitlin. I'm actually going to switch up the agenda a little bit because, sorry, well, it should be fine because there's only one attachment, which you can pull up now. I'm going to do system performance measures last. On the coordinated entry toolkit, just so you all know, it will be released on the 15th of this month. We're very excited to finally be getting this out to you all. Yes. So keep your eyes peeled for that. And just an update on the point-in-time count and housing inventory count. I think we are really close on getting all of our PIT reports out to our communities, and we are unfortunately still working on our housing inventory count with some projects around our coverage area. So if you've gotten an email or a phone call from us in the past couple days. You're going to keep getting those
Or
until...
those ones I got it this morning that responded.
Right.
And some of y'all are here, and thank you very much for that.
Yes. We can't submit to HUD until we have data for every project in our coverage area that's on our HIC. So we just ask nicely, please, if you receive anything from us that's marked as urgent this week about your housing inventory count, please respond as quickly as possible. The sooner we can get that, the sooner we can get it submitted and we can get all of this data out to you all. And just want to say generally, I think most of you know Lindsay Marsh, and if you were on the last meeting, has moved on from THN. She's working for TDHCA. We're currently interviewing for her position. We will be having a debrief on the pit within the next couple of weeks just to talk about how things went and what we can do to improve the process for next year. And I do want to say we've definitely seen, and I think I mentioned this at the last meeting, but a really significant increase in volunteers working on the pit across our communities, which is fantastic, and thank you all for all of the work that you're doing. I think that's also a reason we're going to see a slight increase in our numbers this year. There are other reasons too, and we'll be digging into all of those, but you know, that's not what we want to see, but if that's the case, we definitely want to know. And I really do think these increased volunteers are going to give us a more accurate count, which is what we want to have. So thank you for all of your work. And again, we'll be reaching out to our LHC leads and our PIT leads across our participating communities to do a debrief webinar so we can start planning for next year. Our Corporation for Supportive Housing, our CSHTA, we're supposed to be getting our needs assessment back this week, and I've been guaranteed that that will happen. So again, we've been waiting on that before we start working with you all on some changes, not just within our structure here, but with some of the work that we're doing and definitely with our work plan moving forward. So just wanted you all to know that that is still in the works, and we should be getting the detailed report from them soon and should have a lot to share with you all. And I'm going to go ahead and move on to system performance measures. So what we have up on the screen are the system performance measures we submitted with our last CoC application. These ran from October 14 through September 15. And just, we went over these close-ish to the application, but I really want to go through each of these with you all. And I'll go through each measure specifically, but one thing we learned at NEH this year when we went to our HUD session is that over the next couple of years, these system-wide performance measures are going to account for 40% of our CoC application. I'm going to say that one more time. These system-wide performance measures are going to be counting, and it will increase over the next couple of years, but eventually will be around 40% of our entire application score. So we obviously want to start working on these now, have them looking at them. We have them pulled for the most recent year. Actually, staff is looking at them and reviewing them right now. So our next meeting we'll be able to compare these 2 years. This was the first year that we were able to run this report. It was the first year we submitted it with our application. It's been in the works for, I don't know, 4 to 5 years. We've been waiting for this report to be accessible to us, and I'll go through with you all each of these measures and which ones we never had access to before. And overall, it's really great information. You know, it's definitely going to push us all to work together and collaborate even more, you know, within your communities and within our entire geography and the balance of state. These reports were designed to be run CoC-wide. We're working on how to make sure they're accurate for your communities and your individual projects. We're working with lots of folks on this right now, and like most things designed for the CoC are for small CoCs. not balances of state. So typically, you know, one county, maybe two, maybe three, not 215. We were able to spend some time with some of our other peers in balances of state when we were at the NAH conference, and they're all, you know, experiencing the same struggles, not as on quite the same level we are, but we're confident we're going to get these reports functioning in a way that they'll be really effective for you all to use. You know, the data is great, but we really need to be able to break it down by community so you all can be tracking these. And the goal is that you all will be reviewing these as communities. And I think the thing here, you know, as with coordinated entry and written standards and kind of all of the things we're doing, the key is it's a community effort. And regardless of your funding source, if your goal is to end homelessness in your community, these are the things that are going to help you do that. And this is the data that you all can look at to help you get a really good picture of where you are and where you need to go and all of the great work that is already happening. So, you know, it's always, we know, a different situation for those that aren't funded by our federal funding sources, but just want to say again, you know, we all have to work together if we're going to end homelessness. We can do that. And if in your communities you're relying on your ESG and CoC projects to help with that effort, then we really need you to jump in as well, because we know they're relying on you. And except for 2 of these measures, everyone in our HMIS system is counting in these, regardless of your funding. So if you're in the system and you're using it, your data is crucial, and we're looking at it, and HUD is looking at it. So let's go ahead and go to measure 1. So this is measuring the number of clients active in the report range and their average and median lengths of homelessness. These numbers are actually really good. We were pleasantly surprised. We definitely had to do a lot of work before we submitted these to HUD, working with projects on ensuring that clients are being exited in a timely manner and actually checked into beds. And these are the reasons we really are working with you all on your data quality and your performance, because everything counts. And you know, what we have is only as good as what gets put into the system. But if you look at these, and these top 2, it's just emergency shelter and transitional housing. That SH stands for safe haven. We don't have any safe haven in the balance of state. So the average length of time homeless in emergency shelter and transitional housing combined was 72 days. Just for emergency shelter is 47, and then the median was 15 and 20. So we all have heard this goal, right? We don't want anyone to be homeless longer than 30 days, if at all possible. And while ending homelessness, we believe it's absolutely doable. We know how challenging that 30-day can be. I know, you know, in projects I've worked with, we've had people in shelter sometimes for years, and that's not ideal. You know, it is what it is, and it also depends on the services you have available regarding, you know, housing case management in your project. So just want to say again, we were surprised and pleasantly surprised to see these numbers, and you all should be as well. So this is also, out of these measures, this is one of the top 2 that's going to be scored in our next application. So you just scroll down. B is not being reported on. It wasn't reported on in 2016. Will probably be reported on 2017, and that was just a change in the data standards. So we can move on to 2. So this is measuring clients who exited into permanent housing destination. This actually goes back 2 years prior to the report date range, and that's because if you look at returns to homelessness, the 3rd one goes back 24 months. So we're looking at clients who were in the system in either street outreach, emergency shelter, transitional housing, or permanent housing, exited to permanent housing, and then what their return rate was. This is data that we never had access to before. Some programs and communities were tracking this on their own, and it was challenging and not incredibly accurate at best because they only knew if clients were coming back to their programs, not if they were coming back into homelessness and entering another project. There's also another reason we really want to encourage communities to get all of your homeless service providers using HMIS, because the only way you're ever going to truly know is if you're all using the same system, where you can figure out a way to combine and aggregate your data from different systems, which I haven't ever seen work well. With domestic violence providers using a comparable database, we are able to combine the data, which is great. So just another plug and reason to use HMIS, even if you don't have to. So as you scroll across these, you'll see the first number is the number of persons who exited from that specific project type to a permanent housing destination: street outreach, emergency shelter, transitional housing, safe haven, permanent housing, and then total returns. And then we go by those blocks of time. So returns in less than 6 months, returns 6 to 12, returns 13 to 24, and then 2 years. So also, you know, these numbers were relatively low. Other thing to note about system performance measures is that we will not be scored against other continuums. We will be scored against ourselves. So as we move forward with these, and thank you, HUD, that was a relief to lots of us. And again, it's just, you know, lots of different things happening in different communities, and in our case, many, many communities make up our continuum. So we're only, you know, going to be working with our data, our prior data, which is great. So again, you can see the percentage of returns, and you'll see, I guess I'm just looking primarily at the 24 months and then 2 years. So the 2 years was anything over 24 months. These are pretty low. You see them increase as time goes by, which isn't surprising. And most often it's returns from emergency shelter, which also isn't surprising because we know that emergency shelter doesn't always track exits. It's really hard to do when clients are coming into a shelter and they're not receiving any case management services, or they're not enrolled in a project, or your emergency shelter doesn't have case management staff, right? Or people are just coming in for low barrier shelter and not really engaging. It's hard to know where they go. So again, we were pleasantly surprised that these numbers were low. Obviously, we would love to see no returns and definitely want to see these percentages decrease over time. But these were also numbers that we were pretty happy to see. And it looks like we have some questions. So Craig, you can pull up number 3, and I'll take a look at these. So we have a question: when will client track and other systems be able to share data from agency to agency? Jenny, we may need to get a little more clarification on your question. Will you type to her?
Yeah, she was asking when we have a local community report.
Craig is going to ask you for some clarification, Jenny. Thanks for your question. John Cooper, if our LHC purchased licenses, could we assign? Oh, I think I emailed you about that, John. And if I didn't, I'll send you another email. And y'all keep your questions coming. If they're relevant to these, we'll answer them now. And if not, we will absolutely get back to you. So measure number 3 is number of homeless persons. This top 3.1 is just comparing our PIT data. That's it. So we're looking at our fiscal year PIT data, and this upcoming year we'll have new numbers. You'll see we had a small increase in emergency shelter, and in total shelter count, all of our other numbers dropped, which is a good thing. It's what we want to see. We're absolutely scored on this. Again, I do think we're going to see some increases in our numbers this year, but I really do think it's due to changes in our PIT count participation and volunteers. And again, other factors, and we'll get all of that data out to you all as soon as we can. If you go to 3.2, this is change in annual count. So this is new. We didn't have access to this report being pulled in this way before system performance measures. And this is just a total number of those in the system, sheltered, safe haven, and transitional housing. So this also, had never asked for this data before. So now they're not just looking in that point in time snapshot. They're also taking into consideration who's in the system. So they're taking both of these numbers. I'm sure that they have some kind of formula. They haven't shared with us what that is yet. But again, it's interesting to compare those in HMIS versus the PIT count. And we know that the PIT is a snapshot, but feel, this is just giving us more data. And we know that there's always more folks experiencing homelessness than we're able to count for the PIT. So we're going to move down to number 4. So for all of metrics 4, and we'll go through all of these, 4.1 through 4.6, these are only for CoC funded projects. Again, so CoC projects, looking at you, and this is a big scoring component in our whole application as well. These numbers are not good. I'm just going to be honest, y'all. They're really low. Change in earned income for adult system stayers. So these are people staying in your projects during that year, people who didn't exit. Out of 215 stayers, only 32 adults with increased earned income. That's 15%. That's low. Go ahead and scroll down. For 4.1 also, we're looking at, again, just CoC funded projects. So now for us, that's just all permanent housing. That's permanent supportive housing and rapid rehousing. We also know that our permanent housing projects are dedicated to those that are chronically homeless. So we would expect the earned income measurement not to be very high. We know a lot of those individuals, well, anybody in PSH has a disability. We also know that doesn't mean people aren't able to work. A lot of them won't be, some of them will. Still, that number is quite low, and it's something we need to work on. For 4.2, it's a change in non-employment cash income for system stayers. That's 215 stayers, 63 with increase, and that's 29%. Again, this one, still low, much better than 15%. Changes in total income for adult stayers, we had 215 stayers, 86 with increases, and 40%. So that's any income source. So that includes mainstream benefits. This number should be a lot higher. Go ahead and scroll down.
We did have a question. Do we know the national averages? And an example, how far behind are we, or where are we in comparison?
We don't have information yet on the other CoCs. I can tell you these are not our metrics in our at least CoC scoring were around this only because they were based on performance, and they're going to be increased significantly. So like with everything else that's happened in the past year or so, you all are going to see higher expectations on meeting these. And we are waiting to get some information on other continuums. We definitely want to try and get information from similar CoCs, which is always challenging for us. But we should have a lot more information on system performance measures before the next competition, and we'll share that data with you all.
Jenny clarified, she's wondering if different client track systems can share. You can probably email her about that.
Yeah, Jenny, I'll email you. It's still challenging even to share within the HMIS systems with different vendors. There is a way that's pretty simple to export data and then have whoever you're sending it to enter it into their system. And if that's something you're looking into doing, we can work with you on that. It's something we're going to be doing soon with our SSVF providers.
One down.
Did we do 4.4? 4.4. Thanks, Mary. Change in earned income for adult system leavers. So this system leavers, folks who exited your project during this reporting range, we had 506, 138 exited with increased income. Again, 27%, little higher than some of these, not as high as we would like to see. Change in non-employment cash income for adult system leavers. We had 506 leavers, 54% exited with increased non-employment cash income, and that's only 11%. And then if you scroll up to 4.6, total income for system leavers. So again, the 506 leavers, 176 with increased total income, 35%. That percentage is a little better. It's still fairly low. You know, one of the first things we know you all are working on with clients as they come into your project is obtaining and or increasing their income, because we know it takes income to obtain and maintain housing. And that is going to look different for different clients, right? It can be from employment, it can be from benefits, maybe working on them with VA benefits, with SSI, with SSDI. And it also, this includes non-cash benefits. So this includes food stamps, this includes Medicaid, this includes TANF. So again, you know, if you're not already in your programs working on this with clients, as soon as they come to your door, really encourage you to start making that a very initial part of your work and your housing stability plans with your clients. Scroll. Sorry, I'm just reading questions to see. We have a question from Damien, or comment. Most of the people coming into our programs already have non-cash benefits, so it's hard to show an increase for them. Really good point. For these, they actually measure if you obtain or maintain those benefits, Damien. So as long as that data is getting entered into HMIS, and they had it when they came in and they have it when they left, they would still count in some of these metrics. So good to know. Lisa, we can send you the link to the report. Again, we're still working on how it pulls for individual projects and or multiple projects versus the entire continuum of care, because it was designed to pull at the CoC level, but we can send it to you.
You may also want to repeat what people's questions are, because I don't know if they can read them in the chat.
I'm sorry, they can't read them.
Damien's asking, is it the same thing with income? If they're coming in with income and maintaining it the entire stay, maintain versus obtain, is that the same rule for that?
Correct, it is the same.
Any more questions on the income questions?
And Lisa Griffin, who was asking about running the report in HMIS for her project, anybody that's interested in doing that, we would love for you to, and to really take a look at these and examine them as we are as well. I mean, you know your program much better than we do, and your instincts may tell you something is not looking right, and it will help us to really examine these, not just within the CoC and with HUD and with our vendor, but on a project level. So I'm going to move on, and if y'all have questions, just keep them coming. Measure 5, number of persons becoming homeless for the first time. Also very important. So 5.1 includes emergency shelter and transitional. Again, I'm just not going to say safe haven. I want, again, to say SH safe haven don't have any in the balance of state. This is also why when clients get entered into your project and you put Safe Haven as their where they're coming from, we tell you to change it. So you should never use Safe Haven in any of your data entry for us. So 5.1 is just emergency shelter and transitional housing, and 5.2 is both of those and permanent housing. So these are folks with no prior enrollments in HMIS. This is the only way we can measure if they're becoming homeless for the first time. I will say, with our continuum, because we still have a lot of projects that are not using HMIS, this data is probably skewed, right? Probably some of these clients were in a project or a program, but we don't have any records of that because they're not using the system. Another good reason to get all of your programs into HMIS.
But if a client was entered in client track with just service only,
they would still come up.
They would?
Yes. Okay. And they're actually changing that because they shouldn't. Because if they're getting supportive services only, they didn't get housing assistance.
Exactly.
And that's what we're doing, right? So if you look at 5.1, again, this is just emergency shelter and transitional. So persons with entries into those during the reporting period, 11,043 of those who were in either of those projects during 24 months prior to that reporting year. So in the previous 2 years, were they in the system at all? 1825. And of those, how many were not in the system in the prior 24 months? 9,218. Dang, that's a lot.
That is.
And it's similar if you go down to the pH numbers, to the numbers that include pH. Again, we're doing a lot on the back end to really look into these. We, again, didn't have access to this report before. I really do think that this has a lot to do with, one, clients using services that are not in the system, and also potentially maybe not the best data entry best practices happening in some places. Or we could be wrong, and these could all be new people, and in that case our work is much more cut out for us than I thought. We'll start to kind of unpack some of this and be able to really take a closer look at the data and see what's going on and what trends we can see once we've had a couple of years working on these. But again, I think the best thing we could do immediately is, one, and these are why we're working on things like coordinated entry with you all, but it's getting your homeless and housing service providers into HMIS. Because odds are these numbers are not that high. And the other thing we're doing, again, is really working on the back end of these reports, what they look like, and how we can ensure that they're going to be accurate when you run them for your project and for your community. I mean, the data is really invaluable, and if you think about what you could do in your community with these numbers and track them on a regular basis, if you're working on CE and maybe you have a veterans initiative going on in your community, also you have a takedown target, you have really concrete numbers and goals and data to work with, and you will see the results of that. Measure 6 isn't applicable, well, it's not applicable to any CoC yet, and probably won't be again this year, so I'm not going to spend any time on that right now. I feel like I just said that really fast. Does anyone else have any questions? And just so you all know, we're going to be talking about and looking at these all the time. We'll also see, HUD has been working on this report since it was released, and it's only going to get better. So we'll see, what kind of changes they make. The actual, none of the measures are going to change. These are also available on the website. We did include these in our application last year. So they're posted and have been. And I'm gonna switch things around again. You don't need, there's no attachments, but this is relevant to our announcement about the CoC program competition. Because again, we're gonna be looking at these really soon and we're gonna have another year to compare them to. I was hoping to have those for you all today, but these reports take longer to run than we remembered. So next meeting we'll definitely go over this last year compared to the most recent year. The CoC program competition, I'm sorry, I'm seeing Danny. So Danny Shaw from Denton is asking, these are not available by LHC area right now. They're available, like the report is in the system, you can pull it. I cannot say how accurate it will be for you right now. Some of the measures we think are right on target, some of them we want to work on a little bit. We'll be sending something out to the LHC soon. We're supposed to be hearing something back today from HUD, which means we'll probably hear back within the next 2 weeks, maybe. Again, if that's something your community is interested in doing, and Danny, I know you all are, I would love to have you all start pulling and looking at some of the stuff on the back end. All it does is help us. And while it may not all be entirely accurate, some of it is, and really starting, I don't know, and this is, I will state, this is just my opinion, and it could be a poor opinion, is anything you can look at that you didn't have before is going to lead to some kind of conversation in your community about any homelessness. So we have a question from Courtney Cross Denton as well. Do these require an extra new entry for HMIS agencies, or is this information being collected from existing programs and intakes? Excellent question, Courtney. It's nothing new for providers. We're gathering all of this from UDEs and program elements that folks are already collecting. I was talking about CoC.
Yes.
Right. Right. We also got confirmation at NAEH about when the NOFA is going to get released for the CoC. Again, lots of changes happening at HUD. I'm sure you all have heard about some of that over the past week. But we are pretty confident, and the HUD staff's office really, I haven't ever heard them throw out dates like that and say we could count on them, so I'm going to go with that. And we're going to have a NOFA released in May or early June, and we will have a little more time than usual, and I'm probably till sometime in August. Uh-oh. Can y'all hear me now? Danny or Jen? Okay, thank you. I'm going to repeat what I just said in case you all didn't hear. We're looking at a May to June NOFA release for the CoC program application, and it will be due in August. So it's coming. Heads up. It's going to be more competitive than last year. I think I can confidently say that's going to happen every year. There's definitely going to be changes in our performance criteria. We will absolutely be looking at reallocations again this year. We've reallocated all of our transitional housing, so we will now be primarily reallocating based on project performance. And we'll also say that it was very clearly communicated to us from HUD, and we knew this already, that having a reallocation process is a huge component in our scoring. So not something we like to do, not something anyone likes to do. I know uncomfortable for our board, just want to let you all know it's going to be a tough competition again. We really knocked it out of the park this past competition, and I suspect we'll continue to do that, but we have a lot of work ahead of us, and there's going to be a huge focus on coordinated entry over this next year, and May is not far away. So, our coordinated entry implementation date, sorry, we're seeing messages, I'm still cutting in and out. Veronica, can you hear me now? Or Courtney? Andrea? Anyone?
Yeah.
Got it. Thank you. So yeah, I'm not gonna, I could go on and on about competition. Just heads up, it's coming. It's gonna be tough for our new projects that were just funded and haven't started implementing yet because you don't have funding or a contract. Y'all will be, in a sense, held harmless in this competition. That's what we did with our grantees last year. If you don't have any data, we can't look at your performance yet. So if you're interested in how that's going to look, you can look at our policies and procedures, and you can look at our application from last year to get an idea of what that's going to look like. Can also tell you we're going to be looking a lot more closely at Housing First fidelity in this competition. It's all well and good to check boxes on an application, and I can just tell you all it's not good enough. And some of you are knocking it out of the park, and I know it's been a big transition, but we are going to be looking closely at how your models have implemented and are continuing to implement. And we're also going to be doing a threshold review a little bit differently this year. I don't believe that will be as intense as it was last year ever again, and I think we're all really happy about that. All of you grantees and applicants included. Feel like we did a lot of catching up this last competition, but we're going to be putting a lot more of that on you as applicants in this next round. And in a sense, we're going to ask you to do a threshold check, a self-threshold assessment before you send anything to us. So that's something to look forward to. Okay, so that's a lot of me talking. And if you all have any more questions, and just want to also say thank you for your questions. It's so hard for us to feel connected to you all sometimes. I know some of you probably hear from us more than you want to, but during these meetings, so we just really appreciate when you engage and ask questions. And I do, as we're moving forward and really looking at data, I hope that these questions and conversations will continue. And I'm going to, did we not do that?
No, we did 7.
Wow, y'all. Thank you.
Hey, you're driving the bus here.
I know. I just drove it off the road.
Sorry, we're reorienting and rerouting Cameron back to the system performance measure, number 7.
I got on to CoC, program competition.
And we couldn't stop her.
Detour. This is why sometimes you need backseat drivers. Okay, measure 7. Successful placement of street outreach and placement and retention of permanent housing. So this is just from our street outreach projects. Those who exited to temporary and institutional definition, and of those above who exited to permanent housing, 74% successful exits. This is really great street outreach. Keep it up. I was surprised this was so high. I hope it's right. We'll find out over the next couple of years. And if it is, fantastic. We know the work you all do is challenging. You're working with our most vulnerable folks out there in our community, so this looks really good.
What do they mean by institutional destinations?
That could be a hospital or jail. Mm-hmm.
Detox facility.
Detox. Yep. All of those. 7.1B. So, and here it's Thank you for bringing that up. Acceptable destinations for street outreach include hospitals and jail. And obviously not where we want those clients to go. That's all I'm going to say about that. I'm open to comments about that. Sometimes some institution, like sometimes a hospital is the most appropriate place. For 7B1, this is just permanent housing destinations. So that is, and this is for emergency shelter, transitional, and permanent housing, rapid rehousing. This is at 30%. So 10,447, 3,145 exits. This is low, but it includes emergency shelter. So, you know, same thing as I said earlier. We know those emergency shelter exits are really hard to capture. And if there's a client getting services in your shelter and they're not getting housing-based case management, if your shelters are as busy as the ones that we've worked in, you know, you don't know where those folks go. Ideally, you know, if they've been there for a certain amount of time or they keep showing up, you want to make sure they do get engaged with a housing case manager. So this is a number we're definitely hoping to see increase. You know, the transitional housing numbers probably also bring this down a bit. We just know, and this is one of the reasons, and we know it's controversial, that TH has been phased out a little bit, at least from federal funding, is that just the exits to permanent destinations are not as high as others. 7B2 is a change in exit or retention of permanent housing. So this is just, this includes, it's permanent supportive housing. All right, does not include rapid rehousing. So this is an exit from a permanent housing project to either another permanent housing destination or if a client stayed in permanent housing. Does that make sense? Not like you all can answer. If anybody has questions, please ask. So they either stayed in their permanent housing or they exited to another permanent destination. This fantastic 394 out of 436 up 90%. Yeah, yes. This is, I mean, this is fantastic. And so you all know, as far as, you know, there have been questions about benchmarks and things. For CoC project funding, our exit to permanent destinations is set right now at 76%. Most rapid rehousing projects are around 80. So, you know, I would love to see them add one just for rapid rehousing like they do for PSH on these metrics, because I really do think it's important to pull out from the emergency shelter. And honestly, I'd love to see a transitional one. And I just thought of something else to ask our HMIS team if they can do, which they're not going to be excited about. But that number is fantastic. Definitely want to see 7B1 increase, and really interested to share with you all our next meeting the comparison from this term to this most recent year and comparing those 2 years. So now I'm actually done. Sorry about
little measure 7.
I know. Sorry about driving the bus off the street there for a minute. Okay, now if you all have questions, keep them coming. I'm going to stop talking, and Mary's going to talk to you about ESG. All right. No, it was a document. No.
Your Word document.
No.
Hold on, we're finding the document.
You added it, and I don't think it ever got put in.
There you go. All right, so the Texas Department of Housing and Community Affairs, or TDHCA, has released their Notice of Funding Availability, or NOFA, for Emergency Solutions Grant ESG funding for the 2017-18 time period. And we talked to you about this last time, but we have new information, so we wanted to update you. They released that NOFA in January, and we, as the CoC lead agency, are required to fill out what's called the Attachment A form for anyone who's applying for this money. And that form is where we verify whether the applicants have been participating in our CoC general meetings. That is not your local homeless coalition meetings. That is these meetings that we have on the CoC level by webinar every third Wednesday. Second. Whatever Wednesday of the month it is. Second Wednesday of the month. Thank you.
Yeah.
We changed it last year and I'm still behind. On the second Wednesday of the month. So that's what we'll be looking at our attendance records to see if you've attended. We also need to verify that you have consulted with us as the CoC lead on the project that you're proposing in your application, because we want to make sure that you are, you've got a solid program design. If you have collaborative partners, that their roles are clear and that your performance measures are in line with what we're hoping to see, and that your budget meets the requirements that HUD has and the limits that HUD has. So in all kinds of ways, we want to talk to you about your project. And so we had asked for all the materials to be delivered to us or sent to us by March 1st. In the meantime, however, actually on March 1st, TDHCA changed their guidance because they have not heard from HUD. So they don't know what their allocation is yet. So they don't want to move forward with the process of having their applications due at the end of March without knowing their total amount of funding available, which makes complete sense. So our process has been delayed a little bit, but that's good news for you, because that means we have more time to be able to consult on projects and fill out Attachment A forms. And so you missed our original deadline, but we have moved the deadline. So that's what all of this lettering in orange indicates. It just basically says we're in a weird position now with due dates. So we want you to submit your letter of intent to TDHCA. That's the first step in the process of applying. We want you to submit that letter as soon as possible. Then TDHCA will send you your application within 3 to 5 days. Then you will let me know that you've received it, and we will determine a due date for when you need to get your materials to us. And those will be pieces of the application, parts 1, 2, and 3, and your Attachment A form. So we're a little bit more flexible on our due date now than we were before. But thank you to those of you who got the materials in by March 1st. There were 9 of you that we really, in some way, hope to give you some kind of credit for. We're not really sure how that's going to work yet, but we do appreciate that. And I've already started consulting with that group. Some of you tried to get it by March 1st, but it took TDHCA a little bit longer to get your application than they had anticipated. So we don't want to, we don't have any ding-ding going on in any kind of way. But for those of you who have not even started the process yet, you're in luck, because we are able to go ahead and continue to accept Attachment A requests. What we want you to do, again, is submit that letter of intent as soon as possible. Get your application from TDHCA. Let me know that you've gotten it. We will set up a date for a consultation. And we hope to have all of those done by the end of next week, the 17th. Our last 2 weeks here, we are in March, we're going to be doing our rapid rehousing clinic here in Austin. And we will be doing 2 of the ORCO trainings in Denton and Abilene. So we're not going to have a lot of time for working on ESG then. So I'm hoping to wrap this up by next Friday. However, if we're not able to, we will pick up again in April. Just a note too, I've talked with Naomi Cantu now at TDHCA, and she doesn't know what this delay might mean. It might just be a timing delay, and if TDHCA receives the amount of funding that they thought they would receive, then they will continue their process as it was originally planned, just a little bit later than originally planned. If, however, there's a change in the dollar amount, for example, that might change something in their NOFA. If there's a change to the allocations that COCs get, that might make changes for us. She also said if the announcement of their actual allocation becomes too late, they may not be able to have a September 1st contract start date, which is what they were aiming for, which then could affect contract length, which could affect the number of people you're targeting to serve, and so on and so on. So we're in a little bit of a holding pattern. We're doing initial consultations now. If we get the amount of money we think we're going to get, or TDHCA does, we'll just sign your attachment A forms and send them back to you. If, however, something changes with TDHCA's NOFA and we need to consult again, then we will make those arrangements at the time that we know we need to do it. So, again, it's not too late to submit. If you have any questions at all about the ESG consultations and attachment A's, let me know. It's mary@thn.org, and we will be posting this revised guidance on our website later today.
Thanks, Mary. Also, just wanted to repeat a question Beth from Bastrop had for us. She asked if you already have a consultation scheduled, do we keep it? Yes, absolutely keep it. The goal is not to be doing this work while the CoC competition starts. So again, as Mary said, lots of factors at play here, but we're going to move forward. Thanks, Mary. Caitlin?
Hey guys, this is Caitlin Ian, Balance of State Programs Coordinator, and I wanted to let you guys know about a sort of online seminar that THN staff have been taking over the last 4 weeks regarding racial equity and homelessness. Something that a lot of folks don't know is that people of color and minorities are disparately impacted by homelessness, and we want to, as a staff, make sure that we are considering the input and the experience of people of color in designing programs and in having conversations with our communities. So in order to further that, we've been taking this seminar with the Center for Social Innovation, and I think it's called T3. And we wanted to share with you guys some of the resources that they shared with us so that way you can be part of this learning experience alongside us. They provided us with this really awesome handout that has some videos and podcasts for those of you who like to engage with things in a sort of visual or audio way. There's also some books on there for those of you who are bookworms like I am. So there are books about mass incarceration and the impact of homelessness, as well as sort of how race theory and how perceptions of race have evolved over time in the U.S. And how to talk about race at work and making sure that your policies and procedures are equitable and inclusive. So there's books, and also further reading for those of you who like reading but maybe don't want to commit to a whole book. There are some articles down there as well. And I just encourage anybody and everybody to maybe pick one and look at it. Maybe on a lunch break, maybe with your staff, maybe just with a couple of your coworkers. But as we're moving forward, we want to make sure that our programs are inclusive and that we on the THN level and on the Texas Balance State CoC level are making sure that we're being inclusive and providing opportunities to people of color and minorities to be leaders and for their voices to be heard as we go about our work in the homeless services field. So I want to share that with you guys.
Thank you. For those interested, it is in the handout section. It is document number 5.
Thanks, Caitlin. We're going to be sharing more with you all about our experiences with this training. I can just say it's been really great thus far and led to some really sometimes uncomfortable but really important conversations as the staff here And I would really encourage you all to also look into taking this training with your staff. We registered for one and are taking it as a staff, and that's absolutely okay.
I actually
T3.
told Jeff Olivet that we were doing it. Jeff Olivet's the leader, and he was like, awesome, I'm glad you're doing that. So it doesn't have to be expensive, y'all.
Yeah, so consider that, and we'll look forward to talking to you all more about that. Probably, definitely at our next meeting. We're what, through 4 of the
There's one
6?
more.
No, we're up at 4 or 5.
Okay.
So next week will be our last week in
Okay.
taking it, and it's just
So
been
perfect.
transformative for all of us.
And I'm not too sure, but you may be able to go buy the course and watch it since it's already happened. Everything has been recorded, and there's all their materials per week, per conversation that you can check out. So you can take it in your time, show it to your staff, kind of absorb it slowly on your own time.
CoC program competition, we talked about that. We were going to share with you all some resources from the trainings HUD did on the finalized equal access and gender identity rule. Those links are no longer active on the HUD website. We're hoping that's just a coincidence. I've already sent in a question to HUD about it, and we will keep you posted as soon as we learn when those resources are going to be available again, which we hope that they will. I'm going to move on. We're having a CAPER webinar tomorrow. For those of you that don't know what the CAPER is, it's a Consolidated Annual Performance Report for ESG grantees. I was just going to say the due date, but I'm not. Don't quote me on this. It's the 20th or the 21st. If any ESG recipient can confirm that to 20th to TDHCA, Mary says the 20th, then it's the 20th. Thank you, Danny Shaw and Holly. I know you all know. We're having a CAPER webinar tomorrow. If you are an ESG recipient or sub and you're needing to produce this report for TDHCA or for your lead, we highly recommend you attend. If you have not gotten an invitation, please email hmis@thn.org and let them know you need to be added to that list. I'm pretty sure it's up to date. We will be addressing DV exports during this webinar, so y'all don't feel left out. And I hope for all of you this goes smoother than it did last time. My goodness. Sorry, I'm having flashbacks. It's like HPRP, but different.
Yeah, those of you CAPER filler outers last year was really, really challenging.
Bumpy ride.
So here's the thing about that. Your reports are due to TDHC on the 20th, and you're going to hear this from HMIS tomorrow, but I'm going to tell you now, I would run your reports after the webinar and start reviewing them. I can tell you, we've only got 3 people here dealing with lots of other things HMIS related. If you wait until the 18th or the 19th to get help with these reports, there's a good chance we won't be able to help you.
You're going to be out of there.
And we want to help you. Please do not wait until the last minute to get in touch with HMIS for technical assistance on these reports. They may not be available. And then your report's going to be late, and nobody wants that to happen. Org code webinars, and Lisa Griffin, I see your questions, and I'm going to come back to it. Holly Bates. Oh, thanks. Holly was just commenting how, yes, it was traumatic, and she had a lot of help with Ben, and he did an excellent job, so thanks. And Michelle, too. Your HMIS team is awesome. Our reports are ready to send to TDHCA thanks to your HMIS team. Thanks, Michelle. So, see, you, too, can have your reports ready already, even before the webinar. Thanks, y'all. Org code trainings. Org code trainings are coming. Do we have an infographic or something? There we go. You all should have all received an email about these trainings coming up. If you have not, please email Craig and let him know. We'll add you to the list. But if you're on our meeting list, which is how I assume you got to this meeting. You got this email. Our ORCO trainings are going to be in Denton on the 27th and 28th, Abilene the 30th and 31st. Then June, we have Corpus the 12th and 13th, and Galveston the 15th and 16th. We're really excited about these trainings. The first day is going to be how to create an awesome emergency shelter, and second day is housing stabilization. So first day, all emergency shelter, I would strongly encourage anyone providing emergency shelter in the balance of state to get to one of these trainings. You may have been able to attend a really condensed version of this at our conference, or you may have been really lucky and been able to do a longer one with Ian at NAEH last year. We're really excited. It's really important information. Everything you all have heard us talk about the past year about lowering barriers and making housing focused, it's going to be covered here with some pretty fantastic trainers. And it's free. We may be charging a small fee for lunch at some of these trainings, probably not Denton or Abilene. Anyway, we're working out the details, and if we can't provide lunch and there's a quick place to break, we're going to do it anyway. And for those of you in Denton, Abilene, Corpus, and Galveston, I mean, Corpus is covered, but the rest of you, you'll be getting an email really soon from us inquiring about possibilities of donations and or sponsors to help us with food and beverages at these trainings. So day one, emergency shelter operators, anybody interested in opening an emergency shelter, any community leaders in your communities that are interested in systems change and or ending homelessness, we strongly recommend that you get to these trainings. Housing stabilization, anybody providing housing-based case management or wanting to, come. Shelter, transitional housing, rapid rehousing, permanent housing.
Bring it.
Bring folks in your community that are sitting at your table that are ending homelessness or wanting to end homelessness. This is important. Again, we're really excited to be able to do this with you all in the locations that we're doing it. Please spread this information far and wide. Again, these are regional trainings, so ideally we spread them out the way we did to try and get everybody to a training if possible.
We made so many maps trying to figure out these locations.
It's true. I'm going to check real quick because this is pretty much it, just to see. So Corpus, you all are on it. Registration is highest there, and that's not happening until June, so that's interesting. I know we're expecting probably our trainings in Abilene and Galveston not to be quite as big as our Denton and Corpus, but Denton and Abilene folks, please get the word out far and wide. We're blasting this to every email list that we have, but any local listservs or through your coalition or any way that you can help us get the word out there about these, we appreciate you doing that.
And again, it's free.
And it's free.
And you just don't have to get federal funds to go. You don't have to get ESG. You can just go.
Just come. Just
Lisa Griffin had a really great question, actually, regarding any policy recommendations around the new immigration laws for shelters and other places where folks are gathering. We know there have been, at least in Texas, some ICE raids outside of shelters, well in Austin and in other sanctuary cities. I will be honest, we haven't taken a really good look at the new immigration policy. We know it hasn't changed much. And are interested, I'm sure, like most people, to see what happens this time around. We have recently gotten some resources that we just didn't have time to review before, but we've got some resources and guidance. We will review those and send those out. we'll post them with our materials from this meeting, Lisa. There's definitely a couple things out there that we want to share with you all, and thank you for bringing that up. Hi, Bobby, Eric. Yeah, Corpus Christi. That's as close as we'll get. Our hope was that our Valley folks would make it to Corpus, so we would love to see you and some of your team there. I think that's it for us. Jason has a question, and if you all have questions, please feel free, raise your hand, type.
I actually have an announcement.
Oh.
This week is AmeriCorps week.
Woo!
If you,
Sorry, I get excited.
we have a few alums at the table. If you'd like more information about the impact of AmeriCorps, either in Texas or nationwide, please visit nationalservice.gov. Shout out to our AmeriCorps Vista members throughout the balance of the state. Kristen and Jen in our office, Laura Herridge in Abilene, Catherine Gonzalez in Denton, Jessica Palillo in Beaumont, Luke Oa in Tyler, Texas, Loretta Williams in Victoria, and Alexis Williams in Corpus Christi. Thank you all for your hard work and service. For those that don't know, AmeriCorps members commit to a full-time year of service for very limited monetary benefits. And so it really is a dedication and commitment to service in their community. And so we thank them. If you are interested in more information about the future of AmeriCorps and national service programs over the next few years, an organization that you may want to look at is Voices for National Service, and that might be an interesting resource for y'all. So yeah, thanks again for all your hard work. I'm honored to work with all our AmeriCorps members throughout the state.
And our past ones. I'm noticing there's some of the Vistas that are on the phone right now when I was a Vista. So thank y'all.
Hey.
They're still here.
Yeah, and I would never serve, but I worked with several projects that did and oversaw a really fantastic one in Austin that did. I met Jason. You all, this funding is at risk. It's really easy to find out things that you can do about it and folks you can contact, and there are advocacy groups that have done the work for you. So really encourage you to get out and support this program. I've seen it change lives in communities, and I know those of you that have members understand that. The work that these folks do for the little amount that they do it, and I know it's not for the money. It's pretty remarkable, and just the capacity increased by AmeriCorps members and Vistas across the state. And we know there's not funding out there, so there's work happening that just wouldn't happen without these projects. So I really encourage you to advocate for the continued funding for CNCS. So thanks, Jason. I think that's it, y'all. Laura says thank you to Jason for his support. Oh, Maricela, thank you. Also, want to just acknowledge today is International Women's Day. And also now, at least this year, and maybe we don't know for how long, a day without a woman. We're all here. I don't wear red because I'm a redhead, but we're representing, and I know some of us are only going to be shopping at businesses owned by women today. Ideally minority women, if we can make that happen. So Maricela, thank you for acknowledging that, and we want to acknowledge that as well. And now I really think that's it. Will you unmute everyone? It's going to be totally crazy, but if y'all want to say goodbye, you can say goodbye, because we like to hear your voices.
It gets lonely for us sometimes.
It
Want to interact
does.
with all of you and see your faces, and it's hard.
You can always call us, though.
Ooh, do it.
I'm doing it. This is getting scary.
Okay. So yeah, things you should probably.
Yeah.
See, I knew they get my mind.
So,
think
That's good.
yeah,
So, applications or anything, that's not a barrier or
yeah.
Thank you. If y'all have
Bye.
questions, get back to us. You know where to find us. Thank you, Veronica, Thomas, who appreciates information on the website. We'll talk to y'all soon. Have a great week.
Bye.
Bye.